Hello, everyone who's just joined, and welcome to the webinar today. Before we get started, I would like to go just over some logistics for the event. My name is Samantha Lemieux. And so very quickly here, we're very pleased to provide live captioning for the webinar. All of our panelists will be speaking in English, but if you'd like to see captions in another language, please go through the following steps that are also on the screen. So to turn on the live captions, you'll go to the meeting controls panel at the top of your screen and select More, represented by the three dots. Then select Language and Speech and choose the option to turn on live captions. And then those captions will appear at the bottom of your screen below the webinar slides. To change the language your captions appear in, simply select the Settings button near the captions and then select the caption language and choose the language you'd like to see the captions in. Please also note that this webinar is being recorded and that the recording will be shared on the NPI EXPAND website after today's event. And finally, we do encourage all attendees who have joined to submit questions for today's panelists at any time throughout the webinar using the question and answer box at the top of your screen. Our team will be collecting those questions for the Q&A portion of the webinar in just a bit. We'd love to hear what you'd like our panelists to answer. Now I'll turn it over to Jeff Barnes, our project director, to kick us off today. Over to you, Jeff.
Thanks, Samantha. Welcome, good morning, good afternoon, good evening, wherever you are. I'm Jeff Barnes, project director of NPI EXPAND. NPI EXPAND's been operating since 2019, and we've been in over 11 countries throughout the world, as you can see from the map. And as part of our final year of activity, we organized a webinar series called Lessons in Localization. And today's webinar is on localizing gender mainstreaming. As you can imagine, even though we've worked in many sectors throughout the world, one cross-cutting theme has always been integration of gender. Gender impacts so many different sectors and is critical to producing impact in a sustainable fashion. We're hoping we will be able to share some of the activities today that you'll find useful or instructive. The activities concern both our activities around organizational development of local partners, as well as our program implementation that was conducted through the partners. NPI EXPAND worked with over 90 partners in 5 years, and they've always had a lead in designing activities and implementing them. I just want to also point out that after today's webinar, we have 2 more webinars in our series. The next one is going to be focused on resource mobilization for local partners, and the one after that, in our final webinar in our series, will be on local capacity strengthening. With that, I'd like to turn over the webinar to today's facilitator, Rahel Saeed, who's our Senior Technical Advisor, who leads on gender as well for NPI EXPAND. Rahel?
Thank you, Jeff, and greetings, everyone. Thank you for joining us today as we share the exciting work done on gender integration in several NPI EXPAND countries, including from our Kenya and Pakistan partners who are on the panel. My colleague, Bernadette Muyumi, NPI EXPAND Gender Advisor in Kenya, will talk about NPI EXPAND's gender approach and development of the project's gender strategy, after which I will share our gender integration achievements in several countries. I will also introduce the organizational gender assessment tool, which was recently posted on our website. Bernadette, could I invite you, please, to talk about NPI EXPAND's gender approaches and development of the strategy?
Thank you so much, Rahel. Good morning and good evening to everyone. Over to the next slide. Thank you. So generally, at the NPI EXPAND project, we've considered gender to be a critical component of our programming. And for us to do this, we were able to look at how gender will work through the entire project cycle, look at different gender relations, and see how the project results affect both men and women differently. In order to develop the gender strategy, we were closely informed by the USAID Gender Equality and Female Empowerment Policy, as well as the ADC Chapter 205. Next. So in the development of the gender strategy, we considered that gender integration is not as clear to everybody as would be in a typical gender working environment. And so what we did was to look at the global objectives of the NPI EXPAND project and develop a gender integration strategy that speaks to the global project. And the rationale for this was to ensure that the different components of the NPI EXPAND project have subcomponents of gender under each strategic objective. And for that, we had 3 result areas. The first one was on the aspect of organizational sustainability of capable local partners strengthened. And here we looked at the aspect of improving the capacity of local partners to enrich their policies and improve their capacity to deliver on gender outcomes. The second one focused on aspects of service delivery and programming. And in that effect, we looked at a gender outcome of ensuring that our services and programming were inclusive and also focused on ensuring that both women and girls access the services without biases. And thirdly, on the third result area, which was promising and innovative health approaches scaled up through local partnerships for increased sustainability, our key approach was to look at how sustainably interventions can be done, and not just done, but also to be done with an aspect of breaking negative gender biases. So the strategy was done as a guide to inform and allow localization and contextualization to different country programs. The goal for this was to ensure that each country program would do gender work informed by local settings, informed by different co-creation activities, and that at the end of the day, all activities would speak to a broad gender concept. Thank you. Next slide. So the main entry points for ensuring that the gender strategy was implemented was working on various aspects of co-creation in the different countries. We also involved our partners in identifying gender-specific interventions during the work planning sessions. And in the programs grants management aspect, we involved and considered gender factors in selection of partners. This includes and is not limited to identifying organizations that were women-led, and also ensuring that boards of organizations factored gender integration and were gender inclusive. In addition to this, the program got involved in a lot of capacity development across the different country programs. And through this, we were able to do organizational capacity assessments that also involve gender aspects. And alongside this, we involved the organizations in doing their own self-evaluation, monitoring, and reporting on the extent to which they had been able to implement and improve on the gender deliverables that were identified during the co-creation and the work planning. Next slide. Thank you.
Thank you, Bernadette. Before moving on to the country achievements, I just want us to take a quick look at the gender integration continuum adapted by the Interagency Gender Working Group, which helps organizations identify where they are in the process of gender integration and how they can move towards gender transformative change. We have used this as a guide for our gender trainings and activities. For example, our project strategies intentionally focusing on changing inequitable gender norms, i.e., are they gender transformative, or are they accepting the existing gender inequalities and working around them, meaning are they gender accommodating? Information on using the continuum and definitions of the terms is available on the IGWG website at www.igwg.org. And now I will give an overview of our gender integration achievements by country, following which we will hear from our panelists. In Guatemala, the Indigenous Men's Network in Reproductive Health, REDHOSIN, supported men to challenge the machismo culture that can negatively impact women's access to reproductive health services. They trained health clinic employees and civil society organizations on gender equality, gender-based violence, positive masculinities, and men's engagement in family planning and maternal health using a training manual, promote male participation and responsible fatherhood in reproductive health that they supported the Ministry of Public Health and Social Assistance to develop. In Mali, NPI EXPAND facilitated guided discussions with women and delivered educational talks on women's leadership and their role in decision-making, gender-based violence, early marriage, family planning, and malaria prevention through home visits. In every country where NPI EXPAND worked on gender, the activities were identified based on the ground realities, and therefore some of them are similar and some of them vary depending on the context. NPI EXPAND also identified and referred GBV survivors to one-stop centers and referral and community health centers, and provided medical and psychosocial assistance and also covered transportation costs. NPI EXPAND partner Iamane conducted home visits and educational talks on gender and ran a campaign to celebrate 16 days of activism against gender-based violence. In Senegal, NPI EXPAND conducted a gender integration training for Ademas's technical team, and the network, Trekap Sante, organized an advocacy panel on religious leaders' role in sensitizing the community on family planning and women's health. In Tanzania, our partners AMREF Tanzania, THPS, and Makuta developed gender policies where there were none and expanded existing gender policies into gender equality and social inclusion policies following their organizational gender assessments. Partners, as a result of the assessments, addressed male-female employment gaps and integrated gender rights and women's empowerment into health workers training on family planning and tuberculosis, and partners also integrated gender across several of their other projects. In Kenya, NPI EXPAND conducted a gender analysis that informed interventions during co-creation. Gender assessment questions, as Bernadette said, were integrated into the organizational capacity assessments done with all the grantees. Grantees revised their operational documents, including strategic plans, board manuals, finance and human resource manuals, etc., to incorporate gender. ADSSR, who we will hear from in a few minutes, reconstituted their board. One partner established child protection committees in 22 conservancies, and partners engaged boys in supporting girls to address menstrual hygiene management. NPI EXPAND developed gender-specific discussion guides on male engagement, female engagement, gender, health and integration, and community discussion. And Bernadette will talk more about these tools in a few minutes. In Ethiopia, one partner established 35 schoolgirls clubs that shared family planning, maternal, newborn, and child health and behavior change communication messages with 535 schoolgirls. This model is being scaled up by a regional government in primary healthcare units. Partners raised awareness on social accountability, maternal health, and gender equality and social inclusion through a media campaign in local languages. 97% of people said that the campaign provided them with helpful information. Partners integrated adolescent and young girls into community scorecard scoring, since girls are unable to participate in meetings or voice ideas in front of elders. And they conducted monthly gender dialogues, trained 380 male role models on gender equality and social inclusion and male engagement, and conducted monthly gender dialogue sessions. As a result, family planning and maternal, newborn, and child health service use increased in primary healthcare units, and this model was integrated into the government's community-level work. In India, our partners, Center for Catalyzing Change, C3, and Mamta Health Institute for Mother and Child, strengthened government and community systems for family planning access in Jharkhand and Odisha states. They strengthened capacity on family planning, sexual and reproductive health, gender equality, and social inclusion for several thousand individuals in various categories, including the government's community health workers and community leaders. They addressed negative gender and social norms on early marriage and fertility, strengthened community partnerships, engaged with male volunteers, young girls in low-income areas, and persons with disabilities. The National Health Mission is scaling up these trainings for its community health workers, and the Jharkhand state government is adapting material developed by Mamta in Braille for visually impaired persons. C3's district Neopada in Odisha state recorded significant increase in family planning services which was recognized by the state government. In Pakistan, NPI EXPAND worked in physically remote and culturally conservative areas where girls' education is not given priority and women's access to safe and quality reproductive health services is very limited. Partners challenged gender stereotypes, addressed societal and cultural taboos, increased educational opportunities, and raised awareness on men's engagement and family planning and women's access to reproductive health services. They also encouraged entrepreneurial approaches for girls and women. I will let our panelists from Pakistan tell you more about their work themselves. EXPAND also conducted baseline organizational capacity assessments with all its partners in all its countries. Gender was included in all domains. This led the project to develop an organizational gender assessment tool to help partners strengthen their gender integration capacity. We have used this tool in Kenya, Pakistan, and Senegal with local partners. It is important to keep in mind that this assessment should be participatory and demand-driven. It should be ideally facilitated by a gender focal person or advisor and a member of the organization's management team. It should not be a project requirement and it should not be imposed on the organization. Local ownership is essential for a positive outcome and continued use of the tool. The tool itself is self-explanatory with organizational and programmatic categories, guiding questions, suggested actions, and timeframes, which can help form the basis for a more detailed action plan. I am very grateful to our partners from Pakistan who used the tool and gave us feedback on their experience, which we have incorporated into the final version. I will now share a very quick snapshot of the tool. The complete version is posted on our website and we will enter that address in the chat. So as you can see, the tool in the first column includes policy aspirations at the organizational level for the board, staffing, finance, etc. It has guiding questions to help assess the extent to which gender is being integrated. Then it has possible actions that can be taken. And in the rightmost column, there is a time frame. Next, please. The tool has a similar part, which is on programs. And again, the organization's programmatic aspirations and goals. For instance, does it have the capacity to do gender analyses? Are gender deliverables identified? Is data sex disaggregated? Then we move on to questions around status. What is the level of staff knowledge? Are gender analyses conducted? Enter any details in the yes/no column, possible actions that can be taken, and again, timeframes. Next slide, please. And now I'm happy to introduce our partners. Before we turn to our roundtable discussion, we would like to give our panelists a moment to introduce themselves and their organizations. I have a few questions to help facilitate a conversation, and then we will move to questions from the audience. At this time, I would like to ask all the panelists to turn on their cameras. We are excited to have them on board, and we are looking forward to hearing their perspectives. Mary, could we ask you to introduce yourself, please? Mary, you're on mute, I think.
Yes. Hi, everyone. Good morning, good afternoon, good evening. My name is Mary Naikumi from Kenya, and I work with Anglican Development Services, South Rift. We have been partners in NPI EXPAND, implementing the project in one of the counties in Kenya. And we are an Anglican Development Services is a social development arm of the Anglican Church of Kenya. And the South Rift region is located, it works in Southern Rift Valley region in Kenya. We were established in 1983 but a small CBO, but we have since grown into an organization registered and rebranded in 2015. Our vision is to have a sustainable organization honoring God and serving people to achieve dignified living. And we do this in a strategy that encompasses 3 pillars. One of the pillars, next slide. One of the pillars is the community development pillar, which defines our work with our beneficiaries. And we focus on several thematic areas, 5 of them: human health, livelihood and economic empowerment, climate change response, peace building, care and support for orphans and vulnerable children. And we have key cross-cutting matters, gender integration being one of the main ones, disability, emergency response, capacity building, and of course, M&E. They all cut across our work. And I'm proud to say that this came up during our development of a new strategy, in our new strategic plan document. And we are proud to have gender integration into our strategy because this was not so before. Our second key pillar is organizational sustainability, which focuses more internally in strengthening our systems so that we become a more sustainable organization. And we are glad that NPI EXPAND has come in handy to support this pillar within our organization that helps us to strengthen our inner being as an organization. The third one is transformation and property and investment. This one is a pillar that helps us to focus on our financial sustainability so that we are able to keep in business even in times of financial limitations, especially from external funders. In brief, that's who I am and who ADS South Rift is.
Thank you, Mary. Anam, could I ask you to introduce yourself, please?
Thank you, Rahul. Hello, everyone, and thank you so much for joining us today. My name is Anamir, and I'm really excited to be here as part of this important discussion. I currently serve as Manager Grants and Partnerships at the Human Development Foundation. SDF is a humanitarian organization committed to empowering communities and promoting sustainable development in Pakistan. It was founded back in 1997 by the Pakistani American doctors under the mentorship of Dr. Mehboob Haq, one of the visionaries of human development. Our philosophy of helping people help themselves is deeply rooted in the belief that empowering individuals and especially women and girls is vital for the development of any community. Next slide, please. Since 1997, HDF has maintained a holistic approach to community development through our impactful programs, which focused on almost all sectors of life, including education and literacy, primary health care, livelihood and food security, sustainable environment and wash, and social capital development. So for the past 25 years, we have successfully implemented progressive initiatives that have positively impacted the lives of more than 3.7 million people across Pakistan. So we operate in various regions and have our offices in almost all provinces of the country, including Punjab, Sindh, KPK, Balochistan, and Azad Jammu and Kashmir. Next slide, please. So Human Development Foundation partnered with the USAID funded new partnership initiative EXPAND in Pakistan to implement the activities in the Bunair district of KP. The project aimed at improving access to school health services for children and adolescent girls in Tehsil Gagra, of the district Buner. The second component of the project was focused on promoting adolescent health and hygiene through a targeted awareness campaign on MHM. Unlike the traditional donor-driven approach of program design and implementation, the NPI Expand provided us this unique opportunity to enhance our technical and organizational capacity under this capacity strengthening initiative. STF is working in the sector for over 2 decades, and this was for the very first time that under a donor-funded project, a thorough capacity gaps assessment was undertaken, and then continuous support was extended for addressing the identified gaps. So this has actually enabled organizations like HDF to better position ourselves for advancing locally led sustainable development through co-creation approaches. So that's a bit about HDF, but today I'll be sharing more about our experiences and insights on how we have integrated gender within our organization, the challenges we faced, and the transformative impact it has had on HDF. With that,
Great.
I'll hand it back to Rahul. Thank you.
Thank you so much, Anam. Javeria, could I ask you to introduce yourself, please?
Thank you, Rahul, and hi, everyone. My name is Dr. Javeria Swati, and I am the country team lead for NPI Expand Pakistan activity. For Pakistan, we've been working with 15 local partners and issued 24 grants to improve access to health and education services in the most underserved and remote districts in KP province. And I'm happy to share the details and the work that we've done on gender later.
Thank you. And we have already met Bernadette, our Kenya gender advisor. So I will now move over to our questions. So my first question is for Javeria. Javeria, could you talk a little bit about the kind of capacity strengthening support that NPI Expand provided to its partners in Pakistan on organizational and technical gender mainstreaming?
Well, thanks again, Rahul. So for Pakistan, gender disparity is a huge issue in Pakistan, and Pakistan stands like 145th out of 146 countries in terms of gender gap index. So when NPI Expand started, so gender was like at the heart of the agenda of all the work we were doing, and the support that we provided to the grantees was twofold. One was while implementing grants and designing grants, we made sure that their interventions are revolving around gender and they are really making sure to integrate gender into all the activities. And the second fold was to the localization agenda that NPI Expand is working on, and to ensure that the organization's capacity is built in terms of gender capacity strengthening as well. I'm happy to say that when we started with the technical application development phase, so we didn't really start after the grants were executed, but at the technical application stage, we supported the grantees to look at what existing barriers and existing work has been done, and to co-create with the communities and with the government as what can really work in for all other areas, as well as specifically to reduce barriers to access health and education for women. Adaptive management was one support that you're giving on. Mentoring and coaching supports were being done. And then setting special targets to achieve something is like supports we did. In terms of achievements, there's a huge achievement. I don't really have time to talk about all, but just to say that 37,000 children, out of school children, were enrolled in school, and 87% of those were girls. Menstrual hygiene management, you cannot talk about MHM in Pakistan, and we found out innovative approaches that one of our partners tested and made sure that they talk about premarital counseling address. So many things were done to ensure that men engagement is also there in terms of women stepping ahead and ensuring that they are vocal and they understand their importance. Now coming to the main theme, that's the main theme of this webinar, and that's around localization for organizational development. So this is the point where we started with, first of all, sensitizing the whole environment and orienting people on the importance of this agenda. And as I said, it started before their grants were executed. And then it went to the stage where we conducted trainings for them, where we oriented all the partners team in terms of understanding the importance of this. And I must say that we also, this was like one of the challenge, because organizations usually feel that they're doing a lot on gender, but when they go and towards the structured approach, then they understand that there still needs more to be done. We help them in the gender assessment processes and the tools that you discussed about, Rahul, in your presentation. And we help them in making gender action plan, ensuring that the self improvement process that they're doing, but whatever technical support, technical resources they needed, so we were there to provide them with those resources. So basically, this is something. And then lastly, I must say that whatever is not measured is not improved. So we help them make indicators to measure their work against gender and to continue using those indicators even beyond NPI Expand Life to see that what they have achieved and what they plan to achieve. Thank you.
Great. Thank you very much, Javeria. Bernadette, could I ask you to address the same question? What type of, excuse me, capacity strengthening support did you provide to partners on organizational and technical gender integration?
Thank you very much, Rahul. For us in Kenya, our program was focused on gender, health, and environment. That being the case, it was a new concept to different partners in the health, in the gender, and in the environment sector. So one of the things that we did as part of our support was to customize and standardize communication materials. And in developing these communication materials, we factored the aspects of women, the aspects of health, the aspects of environment, so that all the partners that are involved were able to communicate using standardized content, since this aspect of programming was new to them. In addition to this, we also did gender assessments as part of the organizational capacity assessments. And after doing the gender assessments, most of our organizations realized that initially they were talking about gender integration, but in reality, they did not have key documents or key documented practices to show that they were doing gender integration as part of their programming. So with this, we were able to help them identify key action points, and this was done in a participatory way, in which each organization identified a gender focal person, and this gender focal person in the respective organizations was instrumental in assisting the implementation of the gender work as informed by the organizational capacity strengthening work. Followed by this was the review of key documents. Part of the documents that were reviewed were human resource manuals, board manuals, finance manuals, strategic plans, monitoring and evaluation plans to reflect the aspects of gender integration. And in addition to this, we also worked with supporting the different organizations to understand how to do gender analysis for specific programs. This was part of the approach on looking at sustainability, to have different organizations have the capacity to do gender analysis even beyond the life of the project. And above all, we developed communication materials that were used to expand the work on gender integration. I will speak about that later. Thank you, Rahul.
Wonderful. Thank you so much, Bernadette. Mary, could you give us an example of how NPI Expand's capacity strengthening support on gender integration led to a positive impact on ADS-SR? Mary, I think you're on mute.
Sorry. Thank you. I'm very glad to say that we are proud to have been part of the NPI EXPAND, and especially the capacity strengthening component and the programming bit that led us into assessing ourselves on matters of gender integration. And one of the main areas where we have been very successful and made a very positive impact is around our governance, because the board of ADS South Rift has all along been mainly men and has never met the 1/3 gender representation per our national guidelines, our Kenya guidelines. This time round, upon going through some sensitization and looking internally, assessing our organizations, our organization, we were able to, together with the board members, we were able to realize that this is a problem and we need to address it internally. So we had to adjust our board manual when we were revising our board manual to include the integration of one minimum 1/3 gender representation, either gender into the board. And this led us to having at least four ladies within the board out of 11. This has never happened before. And this, it was not easy because we had to hold, to change, to do an overhaul of the board composition and bring in new membership that really considered gender integration. And it took time to fill the four positions. Why? Because we're used to having men, you know, it's easier to, it has been easier as a cultural norm to bring in men as board members. So it took us almost a month to fill one of the positions because the policy was clear. We need to have one third. So we would not bring in anybody. It had to be somebody who bring the one third gender balance per our national guidelines. I think that's one of our key successes. Of course, there are other areas we have been able to through that. It was very instrumental to in approving and looking through our family planning.
Thank you, Mary. I hope.
Planning. Thank you.
Okay, great.
Yeah, thank you. You're muted.
Oops, my apologies. For Anam, can I ask you to address the same question, please? Could you give us an example of how NPI expands capacity strengthening support on gender integration led to a positive impact on HDF? Anam, I think you're on mute.
Yep. Can you hear me now? Yes, we have seen positive changes in our organization. One key achievement which I would like to share is actually the creation of a gender-sensitive workplace. The policies we developed after the assessment and the gender action plan has really improved our working environment and increased gender integration in our projects and day-to-day operations. So first, we started with a series of gender training and workshops, which were conducted under the NPI EXPAND capacity strengthening program. So at HDF, we made sure that staff from both the programs and operations were trained on gender to facilitate smooth and effective integration throughout the organization. The amazing part of the training was that it was not just a one-time event. Rather, after the trainings, we were given a comprehensive tool for a 360-degree assessment of the organization. And with that tool, we conducted a thorough gender assessment in coordination with our senior management and section heads. And we came to know what gender integration policies were already in place within HDF and which ones needed to be added or revised, including for finance, procurement, program, and operation. The tool was really comprehensive with some guided questions, which really helped us in addressing the current gaps. So on the basis of the findings, we developed a comprehensive gender action plan and set target for ourselves. And surprisingly, with that assessment, we found out that in 25 years of working in the sector, we never had a comprehensive gender policy nor a dedicated resource or gender focal person in HDF. So The gender action plan we developed after the assessment basically guided our efforts and led to many achievements and positive outcomes. One of the key achievements is that we developed a gender policy, we developed protection policies, safeguarding policies, and policies for protection from sexual exploitation and abuse, which were all approved by our board of directors and now included in our updated human resource manual. Also, we have 2 gender focal person positions dedicated to leading our gender mainstreaming efforts in HDF now. Also, it was through the assessment we found out that we lack gender balance, especially in senior roles and leadership roles. So in response to that, we now have our first female CFO in the organization in the last 25 years, and we have significantly increased this ratio of females in operational roles, especially in procurement and admin. Also, our staff is now much more gender conscious in their day-to-day operations. I want to share a great example of this change that because often the gender considerations are mostly taken into account during program planning, with the program side leading the charge. But recently, while we were budgeting for a new community health center project, one of our operations team member raised a concern about whether the benches we are considering for the community health center would be comfortable for pregnant women visiting the facility. So this was a big shift in the mindset, showing that the impact has really trickled down, and the operations staff is now considering those gender specific needs and making sure that they are accommodated as well. So besides, we are also focusing on incorporating gender analysis into all phases of our projects, leading to more effective monitoring and evaluation of gender-related outcomes. Now we revised our codes of conduct as well, and this updated code now includes provisions for child protection, sexual harassment in the workplace, and are now prominently displayed across all HDF offices in Pakistan as well. So to conclude, the impact of these changes has been substantial. Our workplace is now more inclusive, our projects are more effective in addressing gender-specific needs, and HDF is better equipped to promote gender equality at all levels. Thank you.
Thank you very much, Anam. And now over to Bernadette. Bernadette, could you talk about the tools or the discussion guides that you developed, particularly about how these were used in the field and what their impact was?
Mm-hmm. Thank you so much, Rahel. In Kenya, as previously mentioned, our program was unique in the sense that it was integrating health, gender, and environment. Therefore, we developed quite a number of discussion guides to propel the discussions. And the development of these discussions was informed through a co-creation process that identified social and behavior change communication as critical to the work that we were going to do in Kenya. And so the first document that was developed was the SBCC strategy. And it is out of this SBCC strategy work that we actually realized that the community was stratified into various populations and components that wield different power dynamics in the community. And as such, we needed to prepare documents that speak to the different audiences. The first discussion that we prepared was a discussion for women, and the discussion with female discussion guide was used primarily to engage the older women. The reason the older women were targeted is because they wield a lot of power in influencing whether or not women will deliver in hospitals and even the uptake of family planning and other maternal health services. As such, they were involved in enabling them to be birth promoters of hospital deliveries and also encouraging child spacing to enable mothers to become healthy. The second one was the male discussion guide. And for the male discussion guide, it was used in traditional community settings of goat eating, where traditionally in the community that we worked, men came together to discuss critical issues and make decisions pertaining to their community. And thereafter, they summed it up with a goat eating ceremony. So this was an innovative approach that was customized, and a male discussion guide was developed to guide men on various aspects. And among this was their involvement in supporting women and girls to manage their menstrual hygiene. And mostly this revolved discussions around resource allocation. Apart from the issues of menstrual hygiene, they also discussed the need to have their women take up family planning and maternal health services. And because the work was being done in the conservation space, the men were also engaged in discussing how resources for conservation could be channeled to improving public health facilities in the field of maternal health and ensuring that community members are responsive and that audiences are created for people to communicate about family planning. Another guide that we developed was a guide that informed gender, health, and environmental integration, creating linkages on how the three components of our project were related and how they had a bearing on the uptake of family planning and maternal health, and also a sustainable environment in terms of the conservation and sustaining the local economic capacity. The fourth one that we developed is an interesting, customized, and innovative guide that was a community guide that related the behaviors of animals, both domestic and wild animals, on how they plan their families naturally as a result of their life in the wild, and relating those examples to human life and the need to conduct and take up progressive practices of family planning and maternal health. And the reason why this particular guide was interesting is because this particular community relates a lot with wildlife and they relate a lot with keeping of domestic animals. As such, conversations relating to their socioeconomic activity and relating this to family planning and maternal health triggered a lot of interest and encouraged members to engage in discussions around family planning, maternal health, menstrual hygiene management in a relaxed environment, which would typically not happen because of the sociocultural barriers. Thank you, Rahel.
Great. Thank you very much, Bernadette. These tools are also posted on the Expand website if anyone wishes to use or to adapt them. Jiveria, could you share your observations on partners' use of NPI EXPAND's organizational gender assessment tool and its impact? Anam shared its impact on HDF. Any observations you'd like to share from the other partners?
Sure, Rahul. So this gender assessment checklist and tools, they were really, I would say, a game changer for gender work while working on this agenda in Pakistan. The reason I say that is that everybody has their own understanding of gender, and everybody thinks that when you talk to them and orient them, so they think that they are doing the right things. But this checklist provided some structured way of looking into the organizational culture, environment, each department. So something out there to understand, to identify the gaps and to see which areas can be improved and which gaps are already there that we are not even looking at. So this was such a structured thing that they could use themselves. Uh, as second thing I would say is that you can see that this assessment tool, it led to the fact that the partners were achieving so many things. They almost all, we have 15 local partners in Pakistan, and all 15 local partners assigned a focal person for gender within their organization. And here I'm referring to the smaller partners who had limited resources, and still they took this as such an important agenda that they assigned this role to somebody in their organizations. They developed gender action plans themselves. And the partners, you can see they were reviewing their policies. Anam has mentioned what HTF has done, and there's so many other partners who already have either reviewed their policies with a gender lens or still in the process of doing so. They ensured, one of our partners, they made sure that there is a childcare area in their office so that they encourage women to join the workforce. Partners have started taking interventions and initiatives to encourage women in the senior management roles, and they're also taking some steps to encourage women to join the workforce, because in Pakistan, as I said, this disparity goes to the household level, and women themselves are reluctant to come and work for the development sector and for other offices. So they are taking steps towards that. So another thing that I can say about this checklist is that as it's a self-assessment tool and we were only facilitating the process, so the partners can go back to this tool whenever they want. And they are doing that. First time you do, the first time you're just doing it for the sake of understanding. And then when they understand its importance, they have done it twice, and then they start identifying the gaps. And this tool lies with them. And because it's a self-assessment process, so it's more, they're owning it more and they are following it more. So I think these two huge impacts are there for the gender assessment tool. But I would also like to say here that it's good to have the experiences. It's good to have an orientation on the tool for the partners, if new partners are starting to use it, because it really helps to unpack different definitions and different steps, which the facilitation role that NPI expanded. So for smaller partners who do not have, or who have limited resources, probably that sort of technical support help them use it more in a more structured manner. Thank you.
Great observations, Deveria. Thank you so much. And over to Mary. Could you talk a little bit about any organizational or technical challenges that you faced when you were integrating gender?
Gender integration in an environment that has not really embraced the gender issues has a few challenges here and there. One of the main ones is challenging the norms. It's not easy. Like I said, it took us time to fill in the total number of board members, because in the mindset, people are used to having the men mainly. And when it comes to filling in the positions of the board, automatically there are those maybe who will feel that this man would do much better, this one is more experienced. So challenging that was not easy, and studying on the position of the new policy and saying no. The other bit, even on at the program level, it looked rather funny, especially when engaging boys on menstrual hygiene sessions, because this is something they are not used to. They know menstrual hygiene is a girl's issue, and it's girls who are taught about the menstrual hygiene and how to go about it, how to use a pad, how to fix it on the panty, for example, and getting the boys appreciate that they need to support their sisters in school, such that they will not have to laugh at them when they are on menstruation and maybe they have soiled their clothes. It's them to provide support. It was not an easy thing. The boys would laugh at it. At some point, they were feeling really shy. At some point, the teachers themselves, especially the male teachers, were finding it rather funny having boys being engaged in learning the use of a sanitary towel, for example. But it came in with a lot of success, because these boys are the ones growing up to be the men. And for example, one of the areas that we are targeting is having resources, men in what would call the communal resource management, like in conservancies, money paid to conservancies. How can these men who have been in this leadership of these conservancies be engaged to give part of that money to support sanitary towels in schools? Yet they don't even understand the whole this thing of the whole issue of menstruation. So it was very challenging, but we are happy that we've made really good strides around that.
Great. Thank you, Mary. Anam, can you talk about maybe one challenge that you faced while you were trying to integrate gender, and any action steps that you took to address it?
Yes, I would like to share a significant hurdle which Dr. Javeria has already mentioned. That is the acceptance and resistance. and getting everyone on board and overcoming the resistance. So because when we discuss increasing the female ratio in finance, procurement, and admin section, so some of the staff members were resistant. Why? Because they were not sure if it was appropriate for women to handle interactions with vendors and other external contacts due to cultural norms and sensitivities. Also, because this is seen as unconventional and potentially problematic in cultural context of some of the areas of Pakistan, because these roles are traditionally seen as more suited to men, and changing that mindset is a tough job. Also, because of these biases and deep-rooted cultural norms, finding suitable female resources was another challenge, especially in the remote areas of KP and Balochistan. Because of these societal restrictions, women preferred working in fields with minimal interactions with men, and go for mostly teaching or health work. So to overcome this, we have initiated a female internship program, and a mentorship program is also under pipeline to build a pool of skilled female professional who could take on roles in finance, procurement, and admin sections in the future. Also, with these initiatives of internship and mentorship program, we are encouraging more women from these areas to step into these roles. So that was one of the significant challenge we faced. Yeah.
Great. Thank you very much, Anam. We have a final round of questions on sustainability. I can see questions have started coming in. So I want to also try and make sure that we have the time to address those. Javeria, how do you see, and you did touch upon this, would you like to add anything else on how you see partners taking gender integration forward post NPI expand, and how do we sustain this process of changing gender norms?
Thank you, Rahul. To summarize, I'm talking about my conclusion before I talk about the detail, and that's that I think I'm seeing a lot of potential, and I'm seeing that the partners are really excited and they welcome the agenda and they really want to take it forward. Why I am saying that is the first thing is that, our main challenge and our main success for the program remained that we had to change this mindset of people towards gender integration, and from gender accommodating towards gender transformative programming. So that was our biggest challenge, because people are used to of being gender accommodating, and people were thinking, that whatever is happening is fine. But once they got oriented, so we can see that they have started working for themselves. As I said earlier, that all these assessments are being done by the partners. General focal points have been assigned by the partners. So there's no activity that NPI Expand has funded for them. Whatever policies have been reviewed, what Anam has referred to, and what other local partners have done, so they have done it on their own, with some sort of technical support that we provided. Otherwise, the major chunk of review and implementation is being done by the partners. So that's one good thing that we are seeing, and from on that basis, we can say that this agenda is going to continue even after this, beyond this project life. Just similarly, in terms of, as I said, engaging women in all activities. So that mindset has also shifted. When we started, so we realized that people think that, men know what the women challenges are and they can represent them, not only at the organizational level, but even at the community level. So this mindset has changed. And when women are coming forward and when women are joining the senior management position, so of course it shows that this is going to change these dynamics. But one thing I must say, this Expand has done a great job in terms of kicking off the ball, and starting this with this momentum. But this momentum must continue, and to ensure that this momentum is continued, we would need support of the other donors and other international partners to support these local organizations to take this agenda forward. And similarly, the local partners to continue using these tools and to continue looking at gender as one of the main thematic core areas. It's just a small cross-cutting agenda, but a main thematic core area as well, to make sure that they sustain. Thank you.
Well said, Javeria. Thank you. Bernadette, could you talk about how you see partners taking gender integration forward post-expand, and how do we sustain this process of changing gender norms? Bernadette, I think you're on mute.
Thank you. Sorry for that. Thank you, Rahel. In my view, the participatory approaches that we used during the capacity assessments, organizational capacity assessments, were very key, because what the assessments did was to identify what looks like an ideal situation and then enable the partners to identify exactly where they are, and then also propose some few deliverables on how they can come from where they are to where they aspire to go. And for me, why that is a very strong approach in promoting sustainability is because it increases the levels of ownership. And then through this process, it also helped to demystify what gender integration really was. And in terms of moving forward, I look at it this way. The fact that the organizational assessments were done at the onset and partners were able to see change, the same was repeated after the project, at the end of the project, and the partners were able to see significant change on what they had done, and therefore developing new roadmaps to continue on the journey of gender integration is instrumental. And of course, continuous coaching and learning, and also the aspect of peer support. And for us in Kenya, the peer support was instrumental because we had bi-weekly check-ins in which different partners were able to learn from each other's interventions, to see what works in other areas and replicate, and also to learn what does not work so that they would look at how they are doing their programming. And so for me, that is a key aspect of sustainability. Also, in addition to this, the fact that this conversation on gender integration was carried out in different settings besides the health structures, using the conservation platforms, using the traditional male engagement platforms, using the religious leaders, means that the discussions around gender work can be carried on even beyond the project timeline, because different people are involved and the communication is happening at the same time across different audiences. Thank you, Rahel.
Thanks, Bernadette. And quickly turning over to partners, in addition to the information you have already shared, is there anything you would like to add on your future plans for gender integration? Mary?
Yes, Rahel. We are glad that we have put in place some of the policy documents that are helping us in integrating gender in our work and within the organization. However, we still have a few gaps here and there. We still have not completed developing our gender policy in the organization, and we're in the process. So we are going on. We still have to work around more sensitization around gender integration, because this is an area that has been implemented more spontaneously instead of being in our plans. So it's very important that we continue trainings and sensitizations around this, both across the beneficiaries that we are working with and the organizational staff, and even at the governance level, including the board members.
Thank you. Anam, anything you'd like to add on future plans in addition to what you've shared with us?
Yes, thank you so much. So the gender action plan we developed with the NPI EXPAND team is really guiding us and keeping us on track with our targets and timelines. And we are really excited about the plans for future for gender integration, and committed to building on the progress we have made so far. One of the main goal is to continue with the regular gender training sessions for all of our staff, ensuring that everyone stays informed and understand the importance of gender equality, and are equally equipped with the required skills to implement the gender sensitive approaches in their day-to-day working and the programs. Additionally, we are also focusing focusing on incorporating gender analysis into the phases of our project. So we want to make sure that from planning to implementation to evaluation, gender considerations are always at the forefront, because the idea is to better address the specific needs and challenges faced by women and men in the programs and the projects. We are also planning to digitize this data collection to streamline and improve the analysis. In terms of hiring practices, as I have already mentioned, that we have started a female internship program, and a mentorship program is also under pipeline, especially for the female staff. So these programs will provide valuable support and opportunities for career development for young females, especially from the coming from the remote areas of KPK. Also, we are planning to design a dedicated space for childcare and nursing for new mothers on our staff. So this was a need that was not addressed before. And during the assessment, we also found out that many female staff members feel excluded from the decision-making process. So to change this, the senior management has planned to establish a committee to ensure that all voices, especially those of our female staff, are heard and incorporated into the strategic decision making. So these are some of the initiatives we have in the pipeline, but the overall aim is to create a more inclusive and supportive environment for everyone at HDF, ensuring that all our programs and daily operations effectively promote gender equality.
Great. Thank you very much. So I am now moving over to the questions that we are receiving, and for all our webinar participants in the audience, please do continue to submit your questions, and we will take as many as we can, time permitting. The first question is for Mary and Anam, and maybe Mary, we could start with you. What were some of the myths around gender integration that you encountered during your work with local organizations, or during your work within your own organization, I would say?
Okay, one of the main ones is the feeling like the women will get into the board and, for example, and they are not vocal. They are not letting their voices be heard. And to some extent, depending on who has been brought on board, really that could be true from the experience. And therefore, we had to be very careful on also who we are bringing on board. That means we need to empower the ladies even more to make sure that they're able to bring out their voices, that even when we are seated in those governance meetings, they are able to articulate issues and be able to bring on board especially real issues, and also stand up for the voices of the fellow women.
Thank you. Anam, can you talk about any myths around gender integration that you encountered within HDF?
Just like I've mentioned before, that there was a significant hurdle because on getting everyone on board and overcoming the resistance, because most of the staff members in our program, in our operation sites, they were of the view that if it was appropriate for women to handle interaction with vendors and other external contracts due to cultural norms and sensitivities around it. Mainly it was because of the lack of understanding of the term gender. So we conducted trainings, we conducted sensitization workshops for the staff of HDF. We also conducted an in-house awareness session for the senior management as well, in order to increase the female ratio in the operation sides, especially in the finance and procurement and operation departments. Along with that, for the regional offices, we conducted orientation sessions on our newly developed gender policy, so that they can better understand the terms and get familiar with the process of gender integration in their day-to-day operations and working. So these were some of the myths and misconceptions that females are not suitable for these roles, which is because of the cultural sensitivity, especially in the remote areas of KP. So
Thank you.
that's it.
Question for Bernadette. Can you talk about the male engagement approaches that NPI EXPAND used? You're on mute, Bernadette.
Yeah. Thank you so much, Rahel. We used quite a number of approaches, and I will mention a few. One of the approaches we used was to do male-to-male engagements. And when I talk about male-to-male, is where men were used to communicate to fellow men. And by so doing, it helped to create a safe environment, a non-judgmental space where men could ask questions that they would ordinarily not ask in the open space or mixed audience spaces. And this approach was used both at community level and even in health facilities where men are able to talk to their fellow men and they speak a language in a sense that they understand each other more. Another one was adopting cultural or traditional structures to work with. And the reason why this was very important is because it helped to retain the power and the appreciation that men are given in the community. That way, our efforts were not seen as trying to antagonize or displace their role in decision making, but then we esteemed that role and still continue to give them power to influence in a positive way. Another significant male engagement strategy that we used was to work with men across different age sets. And the reason why this was very important is because it also helped to bring into the conversations different mindsets and help older men to understand how things have changed, help younger men also to understand the rationale behind some of the traditional practices that we are trying to say no to, and not just say no to, but also identify more progressive ways of addressing similar issues. And that way, men of different age sets were able to share information and then come to a fairly common agreement on what should work, what is termed progressive, and what is good for their wives and their girls back at home. Another significant strategy that we used was using advocates. It was very, very easy for us to influence decision making when men from the same community spoke about the personal decisions they had made. Among the decisions that these men had made were to take their children to school or their female children, their girls to school, and also to contribute or allocate resources for menstrual hygiene products. They also talked about their involvement in promoting child protection. And so giving their own testimonies made it feel like this is not just something that is being done or happening in a different part of the world, but it was something that could also be adopted locally, and that those who had adopted these things were strong and influential members of the community, and therefore others were inspired and motivated to follow suit. So I can say those are some of the strategies and approaches that can be replicated. Thank you.
Okay, great. Thank you. Mary, did you face barriers in integrating gender at the community level? And if you did, how did you address those?
Yes, of course. You know, our project was focusing on family planning and maternal and child health. Family planning, there's a way the traditionally has been practiced, and getting men to understand the new and the modern family planning and the positive areas of modern family planning was not easy. Just sitting the men down and telling them today we need to discuss about family planning, that in itself looked like a female issue, and they would just want to not to sit and listen. But what we did is that we used some male champions, men who have allowed or supported their wives to use modern family planning, and they have successfully been able to bring up their families in a positive way. And these are the people who really made it instrumental, especially to discuss matters on family planning with men in men-only forums. That was one of the major challenges that we were having. The other one is that we were also training the men, the community health volunteers, as community distributors of family planning. And you see, most of the consumers of the modern family planning products are the women. So culturally, it was not an easy thing, but there are those men who came out strongly as the community health volunteers. They didn't fear. And the good thing is that they were also introduced to the communities. After the training, they were introduced in large community meetings just to let everybody know that these are trained men volunteers providing family planning, modern family planning at the community level. That helped us to overcome that challenge to a biggest extent.
Great. Thank you. Javeria, can you talk about why it's important to engage women in finance and administrative roles in an organization? What is the impact when we do that?
Yes, it is very important, because finance, any program or any project is run by a team which comprises of, finance and operation is one of the major pillars. And the challenge we have always been having is that even if the program team is oriented on gender and they want to consider those issues, but if the finance team and the ops team is not on par with them, so it really leads to the challenge in terms of moving forward on this agenda. And as Anam also shared that they also witnessed this change, and this change resulted in the fact that the change in attitude of finance and ops people resulted in the fact that there is more sort of things going on and this finance intern program going on. I must say that this finance and procurement policies, when our partners started working on them, and they realized that there are policies that are completely gender blind, and then they started changing those policies and updating them and bringing in the specific gender policies. So we could see that more women have started joining the workforce for these organizations, which in itself speaks for itself that when you change that environment, so you can lead to encourage women. And unless and until women come on the front face, so we cannot really achieve what we want. But at this moment, Rahal, I would like to go back to your first question. That was the myth around gender. And in Pakistan, one myth that I've heard often is that women cannot be in the finance and ops positions, and women do not know. They probably know, they are very soft-hearted creatures, and they probably know household stuff or maybe just a desk job. So that in itself shows that how women are being dealt with. So this change in finance and environment and procurement policies and encouraging and making it more and having these gender integrated programming, it is a solution if we want to take this holistic agenda.
Great. Thank you very much, Javeria. The next question is for Anam. If it is difficult to talk about menstrual hygiene management in Pakistan, how are you strategizing to break the silence and enhance women's educational participation and achievement?
Yes, thank you so much. Yes, in Pakistan, reproductive health and menstruation are often considered taboo topics viewed as too shameful to discuss openly. This cultural stigma keeps many women from seeking the healthcare they need, leading to a lack of awareness, myths, and misconceptions, and then underutilization of available health services as well. So it was indeed a challenging task for us to talk about menstruation, especially in the remote areas of KP, especially in Bunair. So first of all, the strategies we implemented, first of all, we have launched an awareness campaigns like the Adolescent Girls Awareness Campaign on health it was a targeted menstrual hygiene management campaign. Now we are also expanding this campaign to other areas of the country, including Rahim Yar Khan, Mardan, Lahore, and Karachi as well. So this campaign basically used the behavior change communication to address the stigma and taboos associated with menstruation by providing accurate information in a supportive environment. Secondly, we conduct these sessions in schools in order to create safe space where girls can freely ask questions, they can share their concerns without feeling ashamed. Lastly, we also train teachers to handle these topics sensitively. So there was a complete training. Then we provided them with the module, the accurate information, so that they can provide the right information to their students. This campaign was launched in Bonaire and reached to 3,000 adolescent girls. And I really want to share an interesting observation from these sessions, that when we asked the girls that who told them about periods first, only 3 or 4 raised their hands to say that it was their mothers. So it turned out that a significant number of girls got their first information about menstruation from sources other than their mothers. And most of them indicated that it was their elder sister, cousins, or friends who provided them with the information. So this was a real eye-opener for us, because cultural taboos make it really difficult for even mothers to discuss menstruation openly with their daughters. And it highlighted the need for more open conversations and education around menstrual hygiene. And besides, not getting information also spreads myths and misconceptions around the topic. Another telling moment was when a teacher hesitated to attend the session because her own daughter was participating. So even though she was an educated woman, she felt too shy to share this experience of attending the session with her daughter. So this really highlights the ongoing challenge for girls and women dealing with these cultural norms. But the good news is that our campaign has been adopted by the district education department, and they will be conducting these sessions every 6 months in all the schools of the district. Additionally, as I have mentioned, that we have duplicated the project in other areas. We have created a safe environment and safe spaces for discussions where girls can confidently talk about their health issues or any concerns they might have with their teachers and with the trained school staff.
Thank you. And there is a success story on HDF's work on menstrual hygiene management on the NPI EXPAND website for more information and details. We have 2 questions, after which I'm going to wrap this up because we are nearing the end of our time. For all the panelists, one question is, and Anam, I think you just mentioned one example, have any of the interventions that were discussed today been incorporated as part of government policy? Bernadette, could we start with you, please?
Thank you very much. For me, I can say that as much as our project was not working on policy, but what has been adopted is the aspect of male-only discussions. And this has been adopted by the government because in the partners that have come to support family planning and maternal health work, these have been proposed as interventions that work by the county government, and therefore we can say that they have been adopted for implementation at the county and government level. Thank you.
Great, thank you. Mary, is there anything you'd like to add to that? Around policy?
Really, we worked together with Bernadette. I think she has said it all.
Okay, thank you very much. Javeria, would you like to share anything that has been adapted by the government?
Yes, so Rahul, one thing that we did in Pakistan was that we were implementing whatever we're doing very closely with the government. So the government was with us right from the beginning. And that helped us in a way that once is, as Anam just said, that this menstrual hygiene management has been taken up, what work they did. But other than that, the animated video was used by them because as she said, it's very hard to talk about MHM. So, and still, even though you train teachers, but you need an icebreaker for this topic. So this MHM video was taken up by the government, and the government has circulated it to their teachers. Secondly, adolescent and health and hygiene training has been taken up by the non-formal education system, and they are also doing it in their ALP centers. Premarital counseling is the one thing that one of our partners did, and government is learning from them, and government has taken it up and supporting and sending their staff towards the adolescent girls in school spaces to conduct those. Local government representation, local government is an essential element and they're responsible for social service delivery. And in one of our grants, we realized that the female local government representatives were there, but they weren't doing anything. Even when we talked to them about their role, they said that they just sign whatever the men representatives send them, and they are not good enough to understand, how this government system work, and they have just been nominated from the political parties. So we worked with them, and those local government representative women, they learned these citizen scorecards in education and health, and now they have also been institutionalized, and local government has taken up those modules, and women have become an integral part, and women's spaces and women meetings have been provided to them. So these are the few examples.
Great, thank you. Okay, and then Anam, is there anything else you'd like to add about any of HDF's work that was added to policy that we discussed today?
I think Dr. Javeria has mentioned that the menstrual hygiene management campaign was taken up by the KP district departments of education and health as well. We have also set up a reference mechanism in the health, in the district health hospital, in the district hospital as well, so that when the trained teachers, they screen the children, they will follow the reference pathway and they will get their checkups done in the district headquarters. So that was a few of the
Great.
successes of the project. Yes.
Excellent. Thank you. Okay, final question. Starting with Mary, how did you go about identifying and supporting male champions for gender integration, if you focused on that?
Yes, we worked with male champions, and these are men who have been involved and directly engaged in work that in issues of that have been termed as female matters, but they have taken them on board for themselves. We went through the community structures, and through the community structures, community groups, health facilities, we were able to get those men who are identified as courageous and good examples in one area, in this area and that area, especially around matters on family planning, around issues of menstruation, and those who are vocalizing issues of menstrual hygiene, the community health volunteers who are also courageous enough to be trained as community based distributors of family planning commodities. So the community structures were very key in identifying these men, including the religious forums, because these men are known because they go beyond barriers, so they are automatically known within their community structures.
Great. Thank you very much. Anam, anything on male champions?
We never worked with the male champions in our menstrual hygiene management campaign. We basically work with the teachers, the head teachers, the mothers, to talk about menstrual. Yes.
Great. Thank you. Javeria, would you like to add anything on identifying and supporting male champions?
Yeah, sure, Rahul. So what we learned is that when you explain your message very clearly and when you orient men, so they really come forward to become the champions with you. And that is what we observed at both the levels while working with the communities and while working with the partners. So it took us some time earlier to orient them, to make them understand that gender equality doesn't mean that, the women would be, we're not creating some separate creature. So, once they understood, they became with them. I can give you a few examples. These family welfare assistants work in Pakistan to promote family planning, but they're not usually doing their job. They're the public, they are government employees. So once we reached out to them, once we discussed with them, and once we give them some targeted role to go out and talk to the husbands of women and how much difference it would make, so we were seeing that they were really the champions in moving forward. Similarly, religious scholars are a key element in Pakistan for disseminating anything. And our experience remained that we approached a religious scholar with the right thing, and we discussed with them, and they became very open, and they continuously disseminated these messages in their Friday sermons. The school teachers and the head teachers were phenomenal. They also started talking about, one was the women teachers that Anand talked about, but even the male teachers, they started talking about it in the religious schools and madrasas. They started talking about this topic. So we believe that,
Great.
yes, there was one thing that, they came up with, the fear of being backlash, and what would communities say to them if they talk about this agenda. But that's where our role comes in, and that's where we help them and support them in terms of how to talk about this and what messages to give.
Great.
So
Thank you.
is it-
Thanks. Bernadette, very quickly, is there anything you'd like to add on male champions before I wrap us up?
Thank you. I think mine is to say that in engaging the male champions, you will experience little by little steps, and they are worth appreciating in terms of informing future programming. So do not be discouraged by seeing small results at the initial stage. Thank you.
Great. Thank you, Bernadette. And with that note, we have come to the end of our time today. I would like to thank everyone for your participation, and I would like to extend our gratitude to the panelists for such a rich discussion and for their hard work. Today's event is the 6th of a series of 8 learning events, as Jeff mentioned in the beginning, and we hope to see you at the next one that we have planned for August 2024. Please sign up for email updates from NPI EXPAND using the link in the chat box and in the follow-up email from EXPAND to receive more information. Please also keep in mind that the recording of today's event will be posted on the NPI EXPAND website, and don't forget to check the NPI EXPAND website and social media pages for more about the project. Thank you again, and have a wonderful rest of the day.
Thank you.